And good afternoon to everyone. Thank you so much for joining this Office of Child Care webinar today. Our plan is to give you an overview of our newly revised state and territory plan for the FY 25-27 triennial cycle. The current version is out for public comment until February 21st, but we know that state and territory CCDF agencies and their local partners have already gotten to work on their plans. And since we do not anticipate major changes in the final version, we wanted to provide this overview for you to help guide your work. So I'm going to quickly go over the agenda. Our agenda for today is to give an overview of our revised approach to the plan and its purposes, to briefly touch on our broader framework for implementation and oversight, and then we will dig in a little bit and give you some examples of some of the changes. We'll touch on some questions we've been receiving and next steps from here. We will eventually have many more resources and training activities, but much of that will need to wait until the final version is published in March. So, the new version of the plan is particularly grounded in the conversations we've had with lead agencies and other stakeholders in the past couple years. We've received really helpful feedback and had many very rich discussions on ways in which we can improve the triennial plan, as well as ways in which we can better align other OCC activities to better support full implementation of CCDF and achieve its many critical goals and purposes. The feedback we received fell into three broad buckets: alignment of our activities, support for full implementation, and transparency about our decision-making and expectations. Some of our key takeaways from these conversations, as well as our own internal analysis, were that we should be better aligning the plan and monitoring timelines, as well as streamlining their related data collection processes. We also heard that we need a process that allows us to issue findings more quickly to lead agencies. We heard that there is more that we can be doing in partnership with lead agencies to consider needed next steps and support for full implementation of the law. And finally, we received helpful feedback on ways in which the plan and our oversight processes can be modified to better communicate our expectations and increase transparency for our collective work together. So based on all of this, we determined to make changes that would help ensure the triennial plan was optimally valuable for lead agencies, for OCC, and for the many child, family, and provider stakeholders across the country that are invaluable to our collective work to build a strong CCDF program that meets the needs of children and families. So to level set, we see three main and interrelated purposes to the triennial plan. The first, of course, is compliance. The federal law is very clear that we must confirm and validate that lead agency policies comply with the law. The second is transparency. The CCDF plan is an important opportunity to collect key data on CCDF policies to provide a comprehensive view of the program. And third, it really serves as an important planning tool. It's an opportunity for lead agencies to look ahead, develop a deeper understanding of their ever-changing child, family, and child care landscape, and determine and share how they plan to build on CCDF policies to address their needs, meet their goals, and work with their partners. Some questions in the plan address just one of these purposes, and others address two or all three. The plan revisions are really grounded in these purposes. In some places, we assess compliance through a simple yes/no question. In others, we ask for more information that will allow us to evaluate whether a lead agency is meeting the minimum threshold in the law to be considered compliant. And in other areas, the law provides lead agencies significant flexibility on how to meet certain policies and requirements. So for these, our questions are less geared to assessing details for compliance and more geared to collecting the information that is useful for all of us to understand the impact of this really important $11.5 billion program and how lead agencies are using these funds to meet urgent needs. The plan also serves, as I said, as an important planning tool and exercise. So it includes questions where lead agencies can describe how they consider their program goals and the needs of the children and family they serve, and identify opportunities to use CCDF to better meet those goals over the coming 3 years, as well as an opportunity to communicate that vision to other key partners. None of this is so different than the last plan, but what we tried to do is be more intentional in the what, the why, and the how, which we ultimately think will benefit all of us. And finally, our approach to the plan is completely grounded in the central policy principles of the law, just as before. Supporting implementation of these key principles is our North Star for this program. And so we've approached the revision with an eye towards making its design and our oversight processes propel us towards accomplishing these important goals. So before I move on to discuss what is different about the revised plan, nope, you can go to the next slide. Thank you. I want to ground us in the many ways in which it actually has not changed. First, the plan remains the formal application for lead agencies to receive a 3-year cycle of funding. The plan still covers all required provisions. The plan is still due to OCC by July 1st of this year. OCC will then have up to 90 days to review the plans and make compliance determinations. And we will be notifying state and territory lead agencies of those decisions by October 1st, 2024. We also will continue to have an on-site monitoring component as a follow-up to the plan approval. That will allow us to validate compliance on a small subset of provisions. We are still going to use annual reports as our primary mechanism to understand quality initiatives and expenditures. That quality set aside and the work that states are doing and territories are doing on this are so important. And we really want to use our annual reports to gather that information primarily. And finally, OCC remains your partner in all of this. In particular, our wonderful, wonderful staff in our OCC regional offices and our terrific National TA Center partners will continue to work in partnership with states and territories on the implementation of CCDF. So now I'm going to move on to an overview of the key changes in this revision. First, we've organized some of the sections and subsections for better clarity and transparency. In order to improve transparency, clarify your expectations, and reduce burden on lead agencies, and really hone in on key policies and principles, we have made some changes to the questions themselves. While all required topics are still included, we've tightened up the questions to better reflect our purpose. As a result, there are fewer questions. The questions are more direct in order to capture enough detail to determine compliance. We've included more questions with self-certification when compliance is really tied to block grant flexibility rather than a threshold. And we've reduced duplication with our other CCDF processes. We've also tried to make the plan stand more on its own, meaning that there are no additional documents for states and territories to submit, no request for specific state regulatory citations. The information that we will be evaluating needs to be specifically included in the plan itself. So instead, the lead agency will provide the information within the plan rather than asking OCC to look through separate documents or external links. Among other benefits, this should really help ensure better consistency in our reviews and in our communication and work with lead agencies. And then to bridge gaps in full implementation across the plan and the on-site monitoring, we have added an appendix of findings to improve transparency and include delineated action steps and timelines for full implementation as well, so that we can have real transparency and clarity on how we are moving forward together. In addition to enhanced alignment with the on-site monitoring, we are focusing more on the policy action itself in the plan rather than the implementation of the policy. This should really ease the burden of completing the plan and will streamline the focus of our on-site monitoring visit, which will serve to validate appropriate implementation of a small subset of policies. We also plan to complete all on-site visits on a much more compressed schedule and use a much more focused scope. So with that macro overview, I'm going to hand things over to Dawn Ramsberg. She's our Director of Program Operations, and she will dive a little bit deeper.
Thank you, Ruth. So let me unpack what Ruth said a little bit more and take it down into some examples for all of us. So I'm going to walk through a few examples, starting with this first one, which is outlining how you will see a shift in the table of contents in terms of, in a couple of ways in the plan. So we have split a couple of the old sections into two separate sections, with the rationale being that we wanted to be able to lift up a few of those of our policy goals. So it clearly was identified within the plan or, organizational structure. And so, for example, the old section 3, which used to ask questions about both eligibility and co-payments, we have now separated those into two sections. So you see section 2 that still focuses on eligibility. And then we have section 3 that is looking at the affordability, which is the co-pay questions. We've done something similar with the old section 1. Which used to ask about the leadership of the program as well as partnerships and coordination with others. And so again, we've split that section up. So we still are focusing at the beginning on the program administration, who's administering the CCDF program, and have pulled that partnership and coordination into its own section farther down the list in the table of contents. So that's kind of example number 1 of how this looks different and kind of the rationale, and that we want to be able to lift up some of our policy goals and be more clear, where we are looking for information for specific purposes. We can go to the next slide. I'm going to unpack this table of contents a bit more. I am not going to speak to the information on the screen, but I'm going to talk about some takeaways that for all of you in terms of these different sections, and really again try to tie the topics with the purposes and some major changes as examples. So section 1 again is really honed in on who has responsibility to implement the CCDF program and how you've worked with your partners in developing the plan. So it's a shortened section and really honed in on that key purpose. Section 2 is focused on eligibility. So we want to understand in section 2 how you are decreasing barriers to enrollment, how you're maximizing your eligibility criteria, and how you're ensuring continuity of care. So that is the purpose and the goal for the information we're collecting in section 2. Section 3 is that pull-out section that I mentioned. This is where you're going to talk about your co-payment policies and how childcare is affordable for families. Section 4 is equal access, but again, really honing in on the full range of providers, your payment rates, payment policies, and the supply of care. Section 5 is where you're going to talk about how you're establishing your health and safety policies, so the requirements that cover provider standards, training, inspections, and the posting of inspection reports. So that's one change here. Posting of inspection reports used to be in the consumer ed section. We've pulled it over here in the health and safety because it's part of the package of the health and safety requirements. And so again, we've put those pieces together to really help us understand how you've put your health and safety requirements together And we have questions that'll help us ensure that those health and safety requirements are covering all the providers that are required. And this is also where you're going to talk about your background checks. Section 6 is looking at workforce. We really want to know how you are supporting the child care workforce. Section 7, again, this is one that is shorter, but again, it's still looking at your quality activities, but we've removed some of the pieces like that are more appropriate to come in that annual report with quality. So you won't see as many questions in this section. Again, section 8 is a new pullout section. This is where the partners that you're coordinating with and how you're approaching coordinating your CCDF program with other partners. This is where you're going to talk about that. Section 9 is going to be where you are talking about your family outreach and consumer education. And then section 10, program integrity, we've expanded this section for lead agencies to speak to the effectiveness of your internal controls. And so there are less questions here about some of the strategies. And really what we want to know from the lead agencies is kind of your general structure and approach to your fiscal and your programmatic oversight and the processes that you use to ensure that your internal controls are effective, meaning how you evaluate your internal controls and how you use the result from your internal controls. So those are kind of our, those are what we want you to talk about in each of those sections. So, so that's how we've aligned this with the policy principles. So if we can go to the next slide. So I'm going to unpack some more examples at a question level. And so Ruth mentioned we have more direct questions in the plan. And so let me talk about what we mean by that. So in this example, you see on the screen, we have the health and safety, a health and safety standards question. And if you remember, there's 10 different health and safety standards. So we've just pulled one of those out. And what we mean by more direct is that we have put in more direct prompts for you to give us the information that shows us that you're meeting the requirement. And so in this standard, this example, we are asking you to give us what your actual language is that shows that you have this standard. Again, as Ruth mentioned, we don't want the links, we don't want citations, we don't want summaries. We want the language that you have that shows that you have this standard. And then we want to know that your standard covers all elements. And so what that means is if you look at the A, B, and C on this slide, in this example, this standard around building and physical premises safety has 3 elements. And so A, B, and C are asking about the pieces, those 3 pieces. So there's a question that's asking about your language that covers the hazards piece of this. There's a question asking about the bodies of water and a question asking about the vehicular traffic. And so in the past, where we would have just said, briefly describe this standard and tell us what practices that the child care program has to implement, we are asking a direct ask of what your language is for that standard. And so not that brief description, but we want to know what your language is. And then the D part of this example is where we are collecting information to help us know that that standard applies to all required CCDF providers. So again, in a more direct way than that descriptive information that you gave in the last plan, we're asking you to indicate to us that all of the required providers that have to meet this, that are required to meet this, are covered by this standard. So if we can go to the next slide, let me talk about what we mean by when we say we've replaced narrative with some self-certification. And so again, with the block grant, right, there are a lot of provisions where the lead agency has flexibility in what you implement and how you implement it. And so we have used a model of self-certification questions to collect information to really determine yes, no, if you have a policy in place that exists for those types of requirements. So we want to know that you have the policy and that it's in effect. But we are not asking for the narrative to demonstrate that, but asking you to self-certify by checking the yes or the no if you don't have it. And so again, in this example, which is looking at the reporting changes requirement within the 12-month eligibility provision. So how you see that self-certification approach is, you know, with reporting changes, CCDF has established that there are parameters for limited circumstances in which families would report changes. And so if, as a lead agency, you don't ask families to report information outside of those limited parameters that are applicable, that are, you know, are applied to all families receiving CCDF, we don't need additional information on what those, we don't need that additional information. So you would just simply check yes, like that I don't require families to report any other changes beyond those that are allowed under the federal law. And with that, you have self-certified, and we are clear that you have it and don't have to look through that narrative. So if we go to the next slide, can unpack this a little bit more. So what do we mean by less process focused? So we have replaced questions in the plan that asked for a lot of description about process and procedures, and really tried to hone in on the questions that focus on the policy or the piece that focuses on the compliance action. And so we also have taken things out of the document where it really was serving more of a TA focus. And again, so things like process, how you do it, who you worked with, are really helpful from a TA point of view, but are not needed from the compliance point of view. And so we will still gather that information, but through other mechanisms outside the plan. And so again, as a couple of examples that are on this slide, the first one you have is around background checks. And so knowing where we are with implementing CCDBG, we want the plan to focus specifically on whether or not the lead agency is meeting the background check requirement and not how you're doing it. And so instead of asking you about your procedures for conducting background checks and your process for disqualifying, we're asking if you conduct the checks for all providers that you're required to conduct them for, and if you're applying the required CCDF disqualifications. And so this is a more direct and a less process-oriented question. Similarly, in the eligibility for the family assets requirement, as the second example on the slide, we are asking you to self-certify that in your eligibility process that you address the requirement that families don't, that families who have assets that exceed $1 million are not eligible for the program. In the past, we asked you to describe how you did this, but what we really want to know is that you have it in place and not how. And so this is just a couple of examples where we think it'll be less burden on you all while still giving us the critical data to be able to assess compliance. So if we go to the next slide, I am going to talk a bit more about the plan appendix that Ruth mentioned in the what is different slide. And so what we have added to the plan, the draft that is out for public comment, is an appendix. In the draft, what you see is this blank template. It does not have a lot of instructions at this point, but let me talk about kind of what our intent here is with this appendix. So this appendix is going to be the mechanism for lead agencies to tell us what your implementation action plan is in response to any non-compliances that we do find in the review of plan. So this is gonna serve as the template for your 60-day response that you can submit in response to non-compliances. It will be used as part of the plan process and then in the future as part of the monitoring process. Because it's serving that 60-day response, it will be submitted in December. So 60 days after the plan approval letters are issued, that would be the time frame when this would come back into us. So this is going to let us, review your plans, be able to issue approval letters. And then once you see where there are non-compliances, then you will have this template available to be able to submit it within 60 days, to be able to give us a clear picture of kind of the steps that are going to happen to come into compliance. This appendix will be able to be amended. It is a living document. And like we said, it'll be used for monitoring. So we want it to be something that is not a point in time, but is something that can be changed and updated. And then I will just close on this by saying that when the final plan is available to you all, there will be more guidance and instruction on what to include and how this will be used. But this is the mechanism that we want to have available to you to help bridge that place between what you have in your plan and when we find non-compliances to understanding what is going to happen to bring you into compliance. So if we go to the next slide, I want to illustrate, unpack another point that we talked about in terms of how we use the plan to better align with other reporting tools. And so this slide is showing kind of our approach to looking at quality activities. And so when we said that we removed some questions from the plan, because they were a better fit with other tools and used quality as one of those examples. Just to give folks a little bit of background, when the annual quality progress report was launched as part of reauthorization, we used the plan as the mechanism to both identify the activities that you were planning to invest in, and we also used it to collect information on associated progress indicators. And part of the reason for that is the QPR hadn't launched, at the time that the first plan under reauthorization happened. And so the plan was our place to kind of both be the look ahead and to give us a little bit of information on the look back. But now that we've moved kind of 2 plan cycles since reauthorization and are moving into our 3rd one, we find that the annual quality progress report is going to be a better way to know how lead agencies are investing and making progress on their quality improvement activities. And so the plan is limited to looking at what activities the lead agency plans to invest in, and on the quality needs assessment that you all do. So we've limited the scope of the plan to kind of being what you did to evaluate, do a needs assessment on quality, and based on that, kind of what you plan to invest in. The QPR is going to be what your annual report where you tell us actually what activities you invested, what activities you implemented, and your progress on the measures associated with those activities. So it is an annual report, and it It is submitted 90 days after the end of the fiscal year. So it's your chance to reflect on what you actually did instead of what you plan to do. And then the 696 and the other administrative data is going to be where you tell us your actual expenditures on quality. And so again, those two annual kind of look back are going to give us better information than that look ahead. All of that to say, just because the quality section is shorter in the plan, quality is extremely important. And we want those the activities that you all invest in. We know that they're critical to supporting children's development. So again, our removal was not because we're less focused on quality, but we've taken kind of a broad brush look across all of our tools, you know, and the collection of activities, and tried to align the plan, the QPR, and the 696 to more effectively understand the investments that you're making in quality. So what money you're spending and what you're spending it on. And so with that, I believe I get to turn to Toya Bryant, who is our director of our Oversight and Accountability Division.
Thank you, Dawn. And hopefully everyone can hear me. So I'm going to share a little bit about monitoring. So as previously shared, we are making improvements to our monitoring approach or approach to on-site validation. These changes are driven by lead agency feedback, which Ruth shared earlier in the presentation. And some of those examples include ensuring better alignment with the plan and monitoring purposes and processes, more timely compliance decisions and feedback to states on their implementation of prioritized requirements, identifying and partnering with lead agencies sooner around TA to better support full implementation of CCDF. So there is more work to be done and decisions to be made on the details of the monitoring process and approach, but today we wanted to just briefly share the framework that we will use to guide our thinking and decisions moving forward. So first and foremost, the plan will be the baseline of compliance through certification of policies. The on-site visit is an opportunity for deeper conversations on the provisions that may not be as evident or clear in the plan, and to validate the implementation of a small subset of policies on the ground. We are proposing a condensed timeline with completing on-site visits around or in the fall of 2026. We propose a narrower scope for the monitoring topics, where we are really honing in on policy priorities and areas of higher non-compliance. And in order to identify and determine what areas we'll focus on, we're really using our compliance data to drive those decisions. Monitoring will take into consideration the new plan appendix that Dawn spoke about to establish the state-specific scope and areas for a deeper dive discussion. With the narrowed scope, or with our focusing on a small subset of provisions, and our focus on implementation, we anticipate a reduced pre-visit desk review and overall preparation for the on-site visit. The on-site visit will include targeted interviews and case file reviews to understand provisions, again, that may not be as clear in the plan, and to validate implementation. And similar to the current approach, we will continue to engage state level, the lead agency, and state level partners, as well as any local level partners who support the implementation of CCDF. And then finally, we want to make sure that we're sharing compliance decisions sooner. This means completing visits a lot sooner, having a condensed timeline, but also making sure that we're turning around our decisions in a more timely manner so that lead agencies are receiving feedback on implementation well in advance of the next plan cycle so that there's time to respond and plan for next steps. So with that, I will hand it back to Dawn.
So given the rationale that we have talked about and the examples that I walked us through and the alignment goal that Toya just walked us through, we wanted to provide a visual of kind of the framework that we took, that we're taking with this plan and looking ahead to the next cycle. So I'm going to walk through kind of what this visual is conveying. And especially how it's pulling out the plan and monitoring, but that it's part of our overall implementation and oversight framework for CCDF across all of the different activities. So starting on the left and looking at July 1st, state plans are going to come in. As Ruth said, it's what's required to be able to authorize the funds for the next 3-year grant period. The plan is the start of that cycle. You're going to tell us what your CCDF policies are. It's going to cover a broad range of requirements, and the plan is going to stand on its own, meaning that you're not going to give us separate documents, links, etc., but you're going to provide the information just like a grant application for other programs. You're going to give us that information in the plan. So that's going to be kind of that is the start of the cycle. As part of our review and approval process, we are going to evaluate CCDF requirements using the information that you have given us. And I want to just note that for states that have an existing non-compliance now, something that has been issued in this cycle, either because of the 22-24 plan or through the monitoring process, if those non-compliances are still in place as of July 1st, you're going to reflect on those when you're responding in your plan, meaning you should not be checking that to certify something when you have a non-compliance that is still in place as of July 1st. And so what you are going to get as part of this approval process then is an approval letter for your plan, but it's going to have a preliminary notice of noncompliance for any elements that cannot be confirmed as compliant based on the information that you've provided to us in the plan. So that letter is going to be a new issuance that incorporates any new noncompliances that were found as part of this plan review, and it would carry any old ones into it by virtue that you have indicated that you still have that non-compliance in this plan. So you're going to get this letter that kind of packages all of that together. In response to that notice, you will be able to submit to us via the plan appendix a response within 60 days. So 60 days after those letters are, those approval letters are sent to you, you have 60 days to give us that response. So December of 2024, you would be doing that. And that is where you are going to outline the steps for coming into compliance. And so this is going to standardize that 60-day response process for you all as well as for us, so that we have consistent information on kind of on where the understanding is around those non-compliances and kind of what the action plan is for those. Then after December 2024, so looking ahead, there's going to be an on-site validation process. So what's called monitoring now. There's going to be an on-site validation process. This is going to be where we verify compliant implementation of some CCDF policies. So it's not going to be all of the same policies that are looked at in the plan. It's going to be a smaller subset. And as part of that on-site validation process, we will look at documents, and there will be some on-site sessions to gather information. After that process happens, then if there are non-compliances found, you would get a preliminary notice, and in response to that, be able to submit a response using that appendix on your implementation plan. So again, this tool, this appendix, right, is our bridge between issuing non-compliance and then knowing how you're going to move forward with that. So we've kind of highlighted these two pieces in these boxes, but I also want everyone to have the takeaway. These are two pieces of our implementation and oversight framework, but they're not the only pieces. So things like error rate review, that is looking at how you are looking at your eligibility processes. The quality progress report, the QPR, are still going to happen. You will still have annual data and fiscal reporting and audits. So the overall implementation and oversight framework includes kind of all of these tools. Plan amendments are also another piece of that. In terms of amendments are the place at which you are able to clear non-compliances, but it also is how you update, your substantial program changes. So all of these are activities that are part of the implementation and oversight framework. And supporting all of this is our technical assistance. So the guidance that you get from the Office of Child Care, as well as through our TA centers, are supports that are available to support all of this work. So again, we look at non-compliances not from a gotcha point of view, but as a learning opportunity for both of us, where there's a gap and how can we bring technical assistance in to help you move forward with full implementation to implement the program so that it's achieving the goals. So if we go to the next slide, I just want to walk through a few FAQs that we've received. So you have this version of the plan. It's out for a 30-day public comment period, but can I use this version to start working on our plan with our planning team and partners? Absolutely, yes. Get started now. When the final version is published, we will provide guidance and TA to help you navigate any changes, but we understand you need to be able to work with your partners and conduct things like public hearings and those sorts of things. We want you to use this plan to start that work. Everyone wants to know, when is the final plan preprint going to be approved? We estimate it'll be available in March. Like I said, it's open for a 30-day comment period. We'll need to look at final changes, etc., before we can have something available, but we estimate that will be in March. Will that final plan preprint be the same? No, but we don't expect major changes. So we expect, and this is based on past experience, there will be some minimal changes because there are going to be some comments that come in. We'll need to clean up some formatting, as we're taking a look at developing training, etc. There's some cleanup that will happen, but for the most part, we don't think there will be major changes. Looking ahead, just, I talked about this in the self-certification slide earlier, but just to reiterate, what does it mean to check to certify? It means that you are confirming that you are implementing a requirement fully, meaning that either all eligible families are covered by the requirement, or all applicable childcare providers are covered by the requirement. So if you check certify, you are affirming that you are implementing the requirement fully. So don't check it if you know that you are not fully implementing it, but that self-certification is your affirmation of yes, that you are certifying that you're implementing the requirement in full. We've had some folks ask if past plan responses can be pre-populated into the new plan, and the answer is no. As we've mentioned a couple of times, each plan stands on its own. They change every 3 years. as one piece of that, but also the process of completing a plan is meant to allow you all to reaffirm your policies, to make sure that they're still meeting the current and emerging needs of your program. So that's a key part of the work with your partners, is what are the current and emerging needs, and where might we need to look at our program and maybe evolve and do something different. And so you will not, your plan won't be pre-populated with any information from prior plans. So how should you respond in the plan if you have an existing notice of non-compliance and it won't be fully implemented by July 1st? So again, just to reiterate on that, if you have an existing non-compliance, you need to reflect and take that status into account when responding to the relevant provision / question in this plan. So again, you should not certify that you have implemented this requirement if you have an existing non-compliant that has not been confirmed, you know, through an amendment and evidence process that it is now in place. Lead agencies can work with your regional offices for additional guidance on this. And again, this will be part of the guidance that comes out with the final plan, but it's really important that you're transparent with us and on this, and it helps us know where we can provide additional guidance and support. And then the final question here is, when will you complete and submit that appendix? So again, that appendix is not going to come in until you have up to 60 days after we've issued the approval letters. And like I said, we'll have additional guidance and detail coming in on that once we have the final approved plan. And so with that, I am going to turn this over to Christine Johnson-Staub, who is a program specialist with me in my program ops division. And she's going to talk about some of the training and technical assistance resources we have available and that we're working on.
Hi, everybody. Great to see so many people turn out for this. As you can imagine, we know that with this new approach, we're going to need some new technical assistance and training resources, and we're hard at work on developing those. Right now, there are some preliminary resources available to lead agencies from their OCC regional offices. So if you're looking for help navigating the most recent version of the plan, if you're looking for answers to some of your questions, the regional offices have some resources that can help you with that, and then others are still being developed. As we develop materials and resources and trainings that speak directly to this new approach to the preprint and the plan, then we will make those available to you. We'll let you know that they exist, and we'll make them available on the Child Care Technical Assistance Network website. We have lots of great people working on these resources and trying to get them as fast as we can, but many of them can't really be developed and finalized until we have the final version of the preprint posted and shared. Next slide, please. So just to go through some next steps that are coming up. As you all know, the public comments on this version of the preprint, the plan preprint, are due February 21st. And so we are waiting to hear from all of you and others about with input on the preprint. And then, as Dawn has said, we'll publish the final version of the plan, fingers crossed, in March. That is the plan right now. And we can't, I saw a question in the chat that was early or late March. We don't know. So, but we will get it to you as soon as we can. And throughout this whole process, through the plan development, through submission, and then through review, we're going to have multiple training opportunities and training resources available to grantees and available to regional staff, so that we're all working together to implement this new vision of what the plan tells us and how the program is implemented and described through the plan. And with that, I think that's all I have on that topic. I just want to really thank everybody for coming out, and on behalf of the whole staff at OCC, we are really excited for this new approach to the plan, and to see what is submitted by all the states and territories, and to work with you all through these next months. So thank you for being here. please do reach out with additional questions and we will do the best we can to answer them. Thank you.